Freud said some funny things, but he did make some astute observations. To paraphrase the slide, no other technique for the conduct of life attaches the individual so firmly to reality as laying emphasis on work. For his work at least gives him a secure place in a portion of reality, in the human community. Marie Jahoda, a positive mental health psychologist before that term was popular, pointed out that work provides structure, provides social meaning, provides an opportunity for social interaction, and provides a sense of identity. Not to mention it provides an income, all of which are critical to our mental health. Nevertheless, a number of people are clearly struggling with mental health conditions and in many cases struggling in the workplace. Mental health conditions are highly prevalent. It's estimated that 1 in 4, and I've even seen estimates of 1 in 2, individuals will at some point in their life have challenges and difficulties which would meet the criteria for a diagnosis of mental health disorder. Furthermore, most mental health disorders occur during late adolescence or early adulthood or in childhood. Thus, they're hitting folks as they are preparing for the work world, unlike some other health conditions which happen later in life. Mental health disorders impact our ability to think clearly, to interact with others, to make good decisions, to concentrate, and become motivated, all of which are critical ingredients in working well in this modern world. Mental health disorders are the fastest rising cause of short and long-term disability. They thus cost employers and Canadian economy a large amount of money. I've seen figures as high as $50 billion a year. Their social cost is absolutely enormous. Mental health conditions also occur with a number of other factors. They occur with other mental health conditions. The most common mental health conditions, anxiety and depression, have a co-occurrence of approximately 50%. In other words, 50% of people with depression also have an anxiety disorder, and vice versa. Given the impact of psychological health conditions on concentration, judgment, and so on, they also play a major role in accidents, injuries, and incidents. This can be particularly important when it comes to things such as safety-sensitive positions in various workplaces. For example, a healthcare provider who is suffering depression may be more likely to make poor decisions with respect to medication, and so on, which could impact people's health, safety, and life, and so on. Mental health conditions also occur with a number of physical health conditions, such as arthritis, chronic pain, diabetes. There is indeed a reciprocal relationship such that depression increases the risk of coronary artery disease. Finally, there are a number of social correlates with mental health disorders. Social determinants such as poverty, malnutrition, lack of housing, or poor education are major factors in the onset, impact, and persistence of mental health disorders. Employers can make a difference. If there were 5 things that I would recommend employers do to impact the psychological health of their workplace and their workers, the first would be to raise awareness about mental health within the workplace via lunch and learns, workplace bulletins, internet within the company, and so on. This helps combat stigma, which was one of the major barriers to seeking appropriate help. The next thing I would do is provide training for managers and supervisors on how to appropriately respond if one of their staff is struggling. This doesn't mean that managers should be attempting to diagnose and certainly not to treat mental health disorders, but supporting employees if they see possible concerns in order to help them find the resources and supports they need to stay at work and stay productive. In this context, it's equally important to intervene early, provide programs which will support people while they're at work, and avoid the possibility or the risk of going off work and things getting worse. Part of this is providing access to good self-care resources, such as stress management training, good exercise facilities and the like, so people can look after their psychological and physical well-being. Finally, if individuals do have to go off work, employers would be very wise to support effective return to work programs and programs that will help people stay at work in order to avoid return to disability. There are a number of excellent resources available. The Mental Health Commission of Canada Workforce Advisory Committee has posted a number of very good resources, including a recent guide, which some colleagues and I prepared, on psychological health and safety, an action guide for employers. My colleagues Simon Fraser and I also have a number of workplace resources, including a new and very useful self-care guide called Positive Coping with Health Conditions, all of which are available at no cost on the web. Finally, the Great West Life Center for Mental Health in the Workplace has provided a wonderful repository of resources for employers, managers, and employees. These can be used in the workplace and make the workplace a better place for all.